Hi, this is Dr. Yusuf presenting to you one case of Malyugin ring removal problem. I wasn't able to remove it the regular way, and I needed to cut that ring to be able to remove it. We start the usual case. So this is the 2.75 knife. This is the xylocaine with phenylephrine in the coat, in the anterior chamber and the cornea, paracentesis, and then this is the implantation of the ring. I did notice at that time that this chamber is a little smaller than the normal. So engage uh, the the nasal and the superior. The inferior one is not engaged yet. So you're gonna engage the subincisional one first because it's most difficult, and then the less difficult until the least difficult. You're gonna refill the chamber with viscoelastic, especially on top of the iris and the ring. Make sure that everything is filled. And just routine cataract. So here we don't mark the cornea because it's already have the ring, which gives you about 7 mm pupil or 6.5. So just go internally 1 mm, and your rexus will be a good size. So take a chopping, and then this is J cannula cortical cleanup, heal on, implanting the lens, and then the removal of the ring. So I usually remove the one on the right first, and through the bar between the temporal and the one on the left, I just disengage the one subincisional and then rotate to bring the superior one into the close to the incision so I can engage it. But this one was actually, the ring is in the behind the incision, so I can't engage it very well with the injector because it's in the subincisional area. So I tried to put it to one side a little to be able to engage it with the injector to extrude it, but it wasn't working very well because I haven't realized, but you can see that this ring is actually spanning. This ring is a 7.2 mm, is actually spanning the whole anterior chamber from one scroll to the other. As you see, the superior and inferior ones are not visible. Of course, he has arcus senilis, but it's not visible. So the cornea here is probably less than 10 mm size. So I decided, okay, I saw that trick in the conference that we can cut the ring and remove it. I can't remember who presented, but I used that trick. So I went in with this is a Westcott scissor. You can use a Vanice, a smaller, and this is McPherson. You just pull it out and roll it out of the incision. This trick became very, very useful. So some of these tricks you learn, you never know when you're gonna use it. And just remove the viscoelastic the regular way. Hydrate the wounds. I use the moxifloxacin for all over the place. So intracameral, intracorneal, and in the bag, and refill the chamber completely with the Moxie. Thank you for watching.